Good afternoon. I'm Dr. Johnny Hamilton, and I'd like to welcome you to the February 10th, 2014 meeting of the DSS Board of Pitt County. I'd like to observe a moment for silent prayer or silent meditation. Okay. All right. I'd like to start off first with the issue of public comments. At this time, no one is signed up. Again, we'd like to welcome input from the citizens of Pitt County to share their feelings and concerns, and this is certainly important to us, and we would like you to make use of this. I'd like to get a motion on today's agenda.
Approve.
I second the motion.
Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed? The same. I'd like a motion on the minutes of the previous meeting.
I move the approval of the minutes as mailed, Mr. Chairman.
And I second it.
Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed? I'm the same. I would like to note that I'm really very enthused about the quality and specificity of, I had to kind of get it out twice, of the minutes. So thank you. All right. Now, these are issues that will require board action, and toss this over to PJ.
Yes, sir. Since we had our last meeting, we've received some funding. The first one on the list is the Emergency Solutions Grant, $58,702. And this funding will be used to help homeless individuals and families regain stable housing in a short period of time. The planning department here in Pitt County is actually the primary lead on this grant funding, but the Department of Social Services will be partnering with them in order to where the oversight, and it's housed in Ms. Dixon's unit, is where Ms. Sharon Edwards is the one that's going to be overlooking the $58,000.
Okay.
Then in addition to that, we've received two separate donations from Greenville Utilities, one in the amount of $2,000 and one in the amount of $5,000, of which these funds will be used to help eligible citizens with their utility bills with Greenville Utilities. And then we had another $360 that came in that's going to also help eligible Pitt County citizens with utility bills that are eligible for using this money.
Okay. This is always great that we do get free money. I really would like to give a shout out to the employees of Greenville Utilities. They are constantly helping us out and helping the citizens of Pitt County, and I really thank them for their help and for their assistance.
Mr. Chairman, I move that we approve the budget amendments that has been
I
presented.
second that.
Okay. Motion has been made and
That would be for all four.
for all four.
Yes, sir.
Yes. Motion has been made and seconded to accept all four of the funds that are listed as on your agenda. All those in favor say aye.
Aye.
All those opposed? Okay. Next, we're going to move to reports to the board.
Good morning, board.
How are you doing?
I'm not good today,
Oh.
but I tell you, we had a very enduring meeting on January 17th at the Cutting Board in Burlington. Very long discussion as it related to counties and boards of social services. Not all of the counties have boards of social services, so therefore the membership has dropped. And it was a long discussion as to how to face the drop in the membership. The consolidated boards it was reported that there seems to be some concern as to how they address the difference between having directors and health boards and the NCASS. And we were encouraged to contact those counties to see if they would join the board. And the determination was that at some point in time, we will have to address it, but right now we decided we will wait till a later time and do some other altercation as it relates to the membership. After the lunch and that long discussion about, there are 80 counties having boards out of the 100. And which caused for the problem. But after the lunch, we had Secretary Wayne Black to address us relating to NC-FAST and the big mistake that was made at the state level regarding sending out information. And he said that there was 50,000 out of the 80,000 children that had health choices instead of Medicaid, and that they were going to correct the problem, and that there was no sensitive information shipped out, and they had received numerous calls because it was causing a lot of problems of complaints with that error. New cards will be issued if it happened. He said that they will send out new food stamp cards, and that they will make up the difference in it. The state erred in these cases because one of the things they said, they had a lot of workarounds in the social service department, and all of these workarounds are causing a lot of problems in technical processes, and they want to get them down to 5. And they're going to try hard to do that. So he was confident that it would happen. And starting January 28th, they would have a 9 a.m. Directors meeting for all 100 directors in the state of North Carolina, or those positions that had equivalent to directors in the state of North Carolina, and that to let them know what they will be facing as it relates to NC-FAST. I understand Medicaid has been postponed until April 1st, 2014. The Medicaid review is postponed to April 1st. There was a lot of talk and there was a lot of concern, and so Mr. Black stood his ground and we went home.
Okay. What is the workaround?
The workarounds are techniques that the staff uses, from what I'm understanding, in their daily activities in social service relating to the NC-FAST, working around the hindrances.
Responding to those emails that we've been getting?
Well, they call them workarounds or something.
Okay.
It's a technical thing, and I'm sure he knows more about it than I do, but it's something that they come up with to work around the problem that they face and the hindrances that they have when they're putting the stuff in NC-FAST. So it was acceptable to me if they got them down and that they wouldn't have any more problems with that. But the 5 out of as many as they were having, it was a large amount that they have in workaround. They want to get them down to 5. I don't know how they're going to do it, but so they're going to try.
Okay.
So that's what it is.
If I may, there are steps that you go through to take and process applications. Sometimes when they make changes, one of those steps don't work. So they have to develop a workaround that particular step to process that application. And that's pretty ambitious if they're going to get them down to 5. I think.
That's what I thought. There seemed to be a large amount of them.
Okay. All right, next we're gonna go to Child Services Assessment. That'll be Margaret.
Probably, if you think back to the board meeting in December, We were talking about the Hardik Patel came to give his MIS report, and we were going over some of the projects that we were looking at within both the income maintenance division and the services division. Couple projects on there we said we wanted to kind of put on the back burner because we were in the process of doing a review of all of our business practices within child welfare specifically. We've been working on that since July, and we're done today. And I am very pleased to have Northwoods here to give this presentation. Tabitha Brady is also in the office, and she's one of our CPS supervisors in the services division, and I just want to thank her for all the collaboration and coordination she did with getting them data and communicating with them to get this final product. But I'd like her, if she would, to introduce our guests from Northwoods as they go over the recommendations.
Thank you for the opportunity for us to come and talk with you about Northwoods and the report that we have. And I do want to thank Michael Draback for all the work that he has done, and Rich Boland for the work that he has done. They have been very helpful to us in this process, and we're really excited for them to come and talk with you about our final report today.
Thank you. Good afternoon, DSS Board, Director Merritt. Appreciate the opportunity to have a few minutes of your time to provide an overview of who Northwoods is, the work we've done in social services agencies, not only here in North Carolina, but across the country. As Tamitha said, my name's Michael Drabeck. I've worked with agencies across North Carolina for over 6 years now. My colleague, Rich Boland, he is the director of our Protective Services Unit, was prior to that, actually spent 20 years in a human services agency in Ohio as a social worker, assistant director, and a director of a child welfare agency. So he brings a wealth of knowledge to our team, and I wanted to have him here today because he worked extensively with Tamitha and Margaret on putting together this document that I'll provide at the end, reviewing your business processes. And I think you guys should be commended, the professionalism, the dedication of your staff to keeping the children of Pitt County and the families safe. So you should really be commended by that, their dedication to that effort. Just real quick, don't want to spend a lot of time, do have a few PowerPoint slides I want to go through. We'll open it up to questions at the end if you do have any questions. But Northwoods provides solutions to increase productivity of case managers and social workers. We do an extensive amount of work in this market across the country. We work in 12 states and 1 territory. And this is the only market we work in. We don't go into any other government departments. We only focus our efforts across child and adult protective services, eligibility services, and then child support as well. So probably most important to you is the work that we've done here in North Carolina. And you can see a graph of the 32 agencies that we work with here in the state, ranging all the way from as small as Transylvania County with 15 workers all the way up to Mecklenburg County with 400 and 500 workers on our system. There's different shades on this map. The dark blue represents the counties we work with only in economic services, so SNAP, Medicaid, work first. The light blue are counties that have actually implemented Northwoods across the entire agency, so at the desktop level. So they've brought on child protective services, adult protective services, foster care, and then the counties are green, are the ones that actually have gone the even additional step of adding our mobile tablet application to allow social workers, when they're actually in the field, begin that data collection, when they're in doing a safety assessment or in an in-home investigation, things along those lines. So you can see we have an extensive amount of experience working across North Carolina and counties and agencies of all different sizes. Here's a quote from Jim Chrisman, the assistant county manager in Beaufort County, on what Northwoods has meant to their agency. Now, Beaufort County uses our solution set across all of their program areas, and they've also implemented our mobile tablet solution within the past 12 months to extend that data collection for their social workers while they're out in the field. One thing I did want to bring note to them, besides being Pitt County's neighbor, also in July in Dallas, Texas, they were honored by the National Association of county officials at the NACO conference for their advancements in DSS technology and what they're doing to protect the children of Beaufort County with our mobile tablet application. Here's just a graph of a efficiency study that we recently conducted based on pre and post implementation in Fairfield County, Ohio. Probably the biggest results of this study is a 9.3% increase in client contact time, but also an 11.7% decrease in documentation time. The reason that is important is we're now able to see more families, able to spend more quality time with families, but our documentation level, electronic documentation level, is still very high. And as Ms. Dixon stated earlier, and she could probably state again, that's what CPS here in Pitt County is measured on. That documentation is accurate. That's what all the reports are gathered on. So it is very important that we're able to see more clients, but we're also to have higher expectations around our documentation. Because what we hear working nationally in child welfare, if it wasn't documented, it didn't happen. Here's just a look, if you look at an average day, pre-Northwoods, post-Northwoods. So the time in documentation, pre-Northwoods, the time doing documentation after Northwoods, client contact time. So we've increased time. Many of your social workers got into this business to maintain the families, keep them together, to put them on a path to improve their quality of life. And by increasing that time that they can expend with each family member is going to increase the probability of that family staying together to get them back on the right track. But also it's important, as I stated, to have that appropriate documentation. And I think the biggest thing is, and you'll see here on the next slide, with these quotes, when workers leave for the day, they no longer feel stressed out. Oh, I didn't get this written up or typed up after my day out in the field. They're not working long overtime hours. So their job morale has actually gone up because when they can go home in the evening, they feel their job is 100% completed because of all of that documentation is captured electronically, able to sign forms out in the field, take pictures of living conditions, in the event of a child abuse situation, take pictures of the abuse situation, real-time interaction with their supervisors back here at the office. So if they need an immediate rolling, do I need to remove the child from a home? You can get that real-time client interaction, reducing visits or reducing travel time. If they forgot something out in the field, having to come back to the agency and going out to their next in-home visit, because everything is available on their mobile tablet device that we would propose that they would take with them. So I don't want to read through all those quotes, but you can see quotes based on time savings, quality of visits, quality of documentation, and then documentation retrieval as well. Some of the challenges, as Tamitha said, we've been working with the agency since July. And these challenges will be documented here in the Modernizing Business Process Review. It's a 16-page document, and it's just information because of how busy Margaret and Tamitha are. We just help compile the data. It's all the data, though, that we collected from your staff. So you can see increasing caseloads, more complex cases with mental health issues, drug and alcohol, behavior, more time being spent at court. Obviously, they have to go to court, but just more time, downtime at court that they could be productive with our mobile tablet application, and then just some underaddressed and underserved business processes. But that is all here in this document that we'll pass out at the end. For us, it was very important before we even designed any code for our mobile tablet application that we completely understood what the social workers did on a day-to-day basis. We actually spent 500 hours running along with social workers, doing in-home visits, safety assessments, investigations, prior to developing any code of our mobile tablet application. So for us, it is kind of a big revolving circle. We've made our solutions very simple and straightforward to use so that they're quickly adopted into their day-to-day process. We understand social workers, they go into it could be sometimes tense situations with what they're dealing in their work. So we want to make sure that their solution is very easy to use and they can quickly adopt it into their day-to-day process as they would with a pen and tablet, digital camera, whatever it may be. And it's important for them to have that instantaneous access to documents, being able to share information with their supervisors, but most importantly for user adoption and project success, that they can quickly adapt it into their day-to-day processes. So here's a look, what they may carry out in the field with them today. So as I talked about, a digital camera, a notepad, forms, just a bunch of different things that they need to carry with them to have a successful in-home visit today. Well, with the new mobile tablet device we've created, all that information is available there. And they can also leverage other things, email, calendar, GPS. So there's a lot of native functionality available on the tablet device, on the iPad, that they can leverage besides above and beyond our application. So there, everything becomes one handheld device, no bigger than the size of this notepad here. Here's a quote from Nikki DeLeon. She is a social worker in Fairfield County, Ohio, just about how much more organized she is, able to track her activities, keeping her peace of mind. As I talked about, instead of going home at the end of the day stressed out that maybe you forgot to do something, she has that peace of mind knowing that all of her activities are complete because our system is able to collect all that data, fill out all the forms. It's in one central place for them instead of across multiple activities. And then the last quote, and I think this is the most important one. This is actually from a mother in Cabarrus County. So Cabarrus County will be our newest project. We're going to implement our tablet device with their investigation staff starting here in February. But this is actually a quote from a mother in Cabarrus County on what it means to her that Cabarrus County is taking these measures to keep the children of that county safe. So I thought that was a very strong quote. It was actually a news report. I can actually send you the link where you can actually see the video of Derek Heath, their CPS supervisor, talking about what it means to them moving forward. Like I said, I do greatly appreciate the time today. Wanted to keep it high level just to kind of inform you of what we're doing, what we've been working with Margaret and Tamitha on. I do have some handouts for the DSS board besides the business process review, some data about Northwoods, news articles that have been published, so we will leave those behind. But I would, if you do have a couple minutes or any questions I can address while we're here, myself or Rich, would love to take that opportunity to address those at this point.
Chairman?
Who pays for this and how much does it cost? I guess it's the thing I'm interested in, or one of the things.
So we've provided a high-level ballpark estimate. Some of this is reimbursable by the state, and some of it would be local county funds. Now, we have been creative. In Beaufort County, we actually did a financing option for them where we split the payments out over the course of 3 years. One of the important things I want to talk about is the training. So besides coming in, tweaking the system to meet Pitt County's exact needs, we also have an extensive training program. So we would train in a classroom setting, but we would also ride along with your social workers in the field those first couple days they go live with our tablet system, because we want to make sure this system is fully adopted and that what you're contributing to us, we want to make sure you get your full value out of the system.
You haven't answered my question.
The rough cost estimate was $580,000.
And what part of that would come from local funds and not come from the state or the federal government?
Typically, it's about 60% comes from local county funds. And then, like I said, a portion of that is reimbursable from the state.
All right, why couldn't Pitt County, these things that you put there is things that I think should be done regardless if they're going to be successful to go out into the homes, those things, which are very good. Let me say that to you. Mm-hmm. And I would hope that our personnel is already doing a lot of these things. If they're doing their job, they're taking the pictures and so forth.
They're definitely taking pictures, but it's disparate activities that they're doing today. To have this all in one centralized system, information stored on the servers here, everything's electronic instead of paper-based, digital pictures that you're printing out and keeping in a paper case file. This is an electronic case file record, so the sharing of information, so I can share information between social workers, my supervisors. It's all stored in a secure location, backed up. If anything were ever to happen, that information's backed up in a secure location. Nothing would ever go away. Today, your social workers are managing paper case files for all of that supporting documentation that goes along with the case. This would be converting it all electronic.
Mr. Manager, isn't this a system like the sheriff's department? He has his computers in his vehicles so that they won't, and they keep all their information. Wouldn't it be on the same?
What he's describing is a mobile system using the tablets where you could use it out in the field. So I mean, it'd be totally separate from anything the sheriff has as an application, but it's similar in concept.
That's what I would think. Very similar on that.
I'd like to know about the security of the system if it's going out and it's going around with the social worker. number one, dropping hazard, damage to the equipment. Number two, loss of the tablet and the data that's in it. And number three, accessibility by, my grandchildren can work my telephone and I can barely get it to dial. So the accessibility of accessing the data by someone who knows how to just happen up on it.
That's a great question. Obviously, because of the sensitive nature of this data, confidentiality is a huge concern.
Yes.
So there's multiple login credentials, there's encryption on the tablet, there's login credentials to be able to access the data. And then we go above and beyond that, and I don't want to get too technical here, but we use a utility called Mobile Device Management, called AirWatch. So that means if I had to leave a home and I left my tablet behind because of the nature of the interaction, and I had to get out of there for my own personal safety, we can actually clear that device with a mobile device management solution where all that information could be wiped out on that device. So security encryption, top priority with us because of the sensitive nature, so that is all definitely taken care of within our system.
When do you anticipate, if Pitt County decides to be involved, when do you anticipate that you will start on something like this, or with the?
We would be ready to roll as soon as you would be able to sign a contract. We've implemented, we have 4 live projects now, so it's just basically, once we had a signed contract, we would start into the discovery phases of our project and start kicking it off.
Well, the way I look at things in my own business and so forth, we got a lot on our plate right now in Social Service Department in Pitt County.
I understand.
And the number one goal for me, as a citizen of Pitt County, is to make sure that we get what we got on our plate fixed before we put other things on that plate.
I understand.
And so that's the way I look at it. Once we get all this stuff that we got on our plate now up to date, I don't want to be throwing more stuff on the employees than they can handle, especially until we get straightened out with what we have there now.
And I think that's one of the great things about our solution, because you're always going to have a list of priorities that you need to get accomplished. Our solution and our training makes user adoption very quick. I know you had talked about NC Fast and some of the issues, and talking to 32 other counties, they're facing a lot of the same issues. With our system, the training is very comprehensive, very hands-on. User adoption is very quick. The documentation, as I talked about, the caseloads continue to grow. The documentation is getting more and more because the cases are getting more complex. That's not going to go away until you actually can implement a system that's going to help resolve some of those issues. And I think that's where us doing hands-on training, ride-along support, making that it's almost second nature for them as part of their day-to-day activities.
I can see the importance of it. I know it's important. But in business, you don't want to overdo your
Oh,
employees.
I understand, because you don't want burnout.
And
you don't want
and you don't have but so much money, and you got to put that priority stuff.
I definitely understand.
The one thing I appreciate what you're doing, because had some concerns about that, and I talked to you about them. We had brought that out in some of the meetings. I think that what you're talking about is very good, because there are certain concerns in terms of filing, in terms of the speed in which we could respond. What the things that I saw that that I feel would be really good, and picking up, not picking on, but going along with what Mr. James is saying, is that the time as an issue. But what you're saying, and that's good, that in actuality the workers would have more time. We've been concerned about issues of stress, that this would address those two things, and that's really very important. So I think that's a very good idea.
Rich, you may want to. Rich, as I talked about, Rich was a child welfare director in the state of Ohio, and he can talk to you about just maybe a couple minutes on the stress that your workers were facing and why you made a decision.
I go along with Mike. Thanks for having us here. I have got to spend a lot of time down in Pitt County, and the staff that you have at DSS are just amazing people. A lot of the things that I've enjoyed hearing, even in this question session, were a lot of those things that are facing that child welfare director on a daily basis. And we had tried a number of solutions. We tried growing in-home things, doing it ourselves, creating document scanning and filing. We tried using ThinkPads, laptops, smartphones. We tried everything. What we were trying to get at was repurposing time that our workers needed to use, and we, you know, I don't like to say efficient, because the workers with the tools that they have today, they're being as efficient as they possibly can. They are working themselves to death doing this work. And when what was hurting me as a director was watching me lose good staff that were doing quality service to children who needed that. I wanted them in the home, but I needed that documentation stuff. So we had to repurpose that time. I had to try and find time that wasn't really there in existence. So after I got tired of spending money, and it was an expense because I kept trying things that wasn't fully integrated with the business operations of my office, because I had them never knowing every day what they're going to walk into, what the court may need, what a medical provider may need, whatever it would be. So we had to find out how to make use of that time. And so when we started doing this project, it was repurposing the time that they had. So when the workers were able to see that those things were done, in child welfare, there's always going to be a never-ending list of things to do. If you give workers an hour and a half a day, they're going to find how they can use that in a family and do more good when they're out there doing those things with family. But that's what we wanted our workers doing. Instead of them documenting things in the office, I wanted them to attend that doctor's appointment with mom and that child. I wanted them to hear so they could help advocate for mom. I wanted them to be very involved. When they went to court, we shouldn't have to ask for a continuance because I couldn't get my documentation in. That was an expense my agency was incurring because I wasn't as proficient as I could be in getting the court the information that they needed. So as we repurposed that and we took use of what we were calling our wait time, and I think that one slide mentioned it, when we did the time study, we had Ashland University professor do a time study with our staff, and they were documenting how much time they were spent waiting. But because we didn't have something that was fully integrated and easy to retrieve information from their case file or bring up a new form or utilize those, they were waiting. Whether they were waiting at a school for a child, at a psychological appointment, at court, whatever the situation was, we were waiting. When they were able to take basically their office out into that situation, they could, and that is a great example because that's where I saw it, our law enforcement. We'd go out to the field and they could do all their stuff. They would just pop up their laptop right there in their vehicle, and I thought, they're that much further done with that situation. But my workers were having to wait. And so we had huge expense in comp time and overtime, and still it didn't even match what our workers were having in what we called donated time, because we were capped out. I couldn't pay them anymore, but they weren't going to stop doing their job. So for me to preserve the good workers that we have, but emphasize the engagement of families and the protection of children, we had to make that quality information that they collected a priority. So all those things that you mentioned that were a priority, I had to go and look at all of these other expenses associated with not addressing the root cause of what was going on in the business practices within our agency. Child welfare is usually the last to get that solution. You know, child support, you have obligees and obligors, and everybody wants to make sure that those things are accurate. There's lots of federal attention on work activities, so that gets addressed, or medical insurance. But child welfare always seems to be left over. And so after years of being under-addressed, the problem's not easily solved with just one application. It has to be something that the workers are going to use. It's no sense in spending money on it if the workers aren't going to use it. And so that had to be top key priority. And so what we were able to see after we were doing that, workers coming back and saying, you know, the one worker, my favorite comment that a worker made to me was, thank you for giving my life back. Because her whole career was just consumed with her families and stuff because it was never ending. So instead of losing those employees, or even having them go to agencies that are taking advantage of these innovative, creative solutions, instead of losing them to those counties, we were able to keep them in our house. So if I was going to invest the money in training and developing and doing that, I wanted to keep them there. They wanted to stay there. But we had to find a way to repurpose that time.
And if I could make one comment. As a former social worker, I can say that we've spent a lot of time talking about North Carolina FAST and the Medicaid and all those things. And child welfare services has kind of been ignored by the board. And that is one of our chief purposes as a board, to implement, protect, and support child welfare services, child protective services, and adult protective services. And yes, this will cost a lot of money, but it goes back to Ms. Perkins' talk about the index cards being used, and I know from a social worker standpoint, being out in the field and supplies being here and law enforcement being needed and judges being needed, if I had had a tablet, instead of earning 12 hours of comp time, I probably wouldn't even have had to, based on what these gentlemen are saying, I would have had not even compared time spent. And we can't forget our children. I mean, no matter how involved we get with these dollars, the children and the adults in protective service situations should be our priority.
But what I'm saying, that should be done already if you're doing your job. I was a classroom teacher, and I know where the problems come a lot of times. That child will tell that teacher everything, especially when they're small. Let's face it.
One of the things I think that Mary is saying, and I really agree with, I wrote it down, is that as an agency, we have to multitask. We have to do a lot of different things at the same time. And certainly NCFAS really took up a lot of our time. And we've been focusing on that and working on that. And that's what we've kind of been guilty of. And I think that we really have to say we're still an agency, we got to do that, and we have to do other things, because I think one of the things is I think some of the workers and services might have felt that we were ignoring them, and what we have to do is be able to do, we're going to have to do a bunch of things all at the same time.
We've got to catch up.
Right, and you're right, a lot of these things would seem to, that they're doing already, but I guess from my viewpoint, being involved, I usually do more adults than children, and certainly in with adult protection agencies, protective services, is that needing certain kinds of data. As an example, pictures of what the abuse might be. If a worker is sitting in a courtroom, and I don't know what the judges would say about this, so judges turn down and ignore this part, that waiting for a case for maybe 2 hours, that worker's sitting there with the mom, and that's dead time. Now what they'll be able to do, they'll be able to do things with the permission of the bailiff and the judge on the computer and get those things done. So that would save a lot of time, because I think you got to the part that's very important is donated time. In this kind of business, a lot of us are donating time, and that's going to give people back their lives. That's going to lower some of the stress, and so it's something that I think is needed, and I think your points are valid. Because you've been doing this, you've been on the front line for a long time.
I'd like to know what departments, where the integration lies, or where the process of streamlining or making invisible the line of some of the department. When you talk about integration, what systems or what departments are you, I know what would be ideal, but I'm trying to figure out I like the green ones on there, by the way, because the children are at victim a lot of time by sight of what you see. And I'm a miser when it coming down to spending money. I'll eat a sandwich when I go off on a trip, but our children are important, Eugene, and the dollar is worth it. And if it's affordable, whatever, I think we should at least look at it and give it an honest a look, because the welfare of the family. I'm very family oriented, and if we can't afford it this moment, Mr. Commissioner, and if we can't afford it right now, Mr. County Manager, I think we should give it an honest examination.
I'd just like to add that the point really of today too is, as we've been presented with projects to, that look like Band-Aids on a bad situation, it was hard to pick what Band-Aids to choose, because the whole point of this really is, and I would like you to, once you get it, to take an opportunity to really read it, because it is a representation of what our situation is today. Compared to where we were 10 years ago, the way the population has grown, what we can expect to happen in the next 10 years. This is about our business practices today, now. It would have been great to add some cost to what these business practices are costing us when we talk about paper and storage and those kinds of things, but just read it. I think it'll generate some thoughts for you. It wasn't to move forward to pick anything. This is hopefully will be a good roadmap for whatever we choose or what Band-Aid we decide to pick this year. I don't know, but it's a great analysis of our current business practices. I would venture to say, even with NC Fast, there are many business practices within the income maintenance division on a local level, because the state isn't going to tell you how to run your show, but we have business practices over there that need attention, the way we do mail, the way we store our files off-site. So there's lots of things in that picture that do translate to cost savings over time. So really that was the big point of today, was to paint that picture of what this looks like, not to sit here and make choices really today about anything. It's just to show you what this looks like.
Well, I agree, Margaret, 100% with that. It does have, you see, you got your senior citizens. You'd be amazed. You know how they're treated in so many cases. And so.
Okay, I guess we need to just focus on that. I really appreciate, Margaret, I really appreciate this, because I had been begging for this and you kept saying, wait, it's coming. So I really appreciate,
Once you read it,
Sure.
To have your comments would be
Okay.
very valuable on what you find in the product.
Well, thank
Sincerely
you.
appreciate the time today.
Thank you very much for coming. We certainly appreciate that.
Thank you.
Don't read it now.
Don't figure out the ending.
Pay
Okay,
attention.
we're gonna move next to, did you want to say something, Margaret?
No.
Okay, but next move to,
I'll go. Let me go.
second quarter statistics. Brian, you gonna do that?
Well, we always toss the coin here, and I get to go first this time, so.
Okay.
This is our second quarter report for the year, and I'm sure you all had an opportunity to look at it. Just want to point out to you some of the highlights in here, as we usually do, and I'll go through each and every one. I believe on page 18 of your report, wanted to point out to you the first one, the number of children in foster care, being the first line, is currently 102. We have had 10 children who found permanency this quarter, which left foster care, and 2 that aged out. We have seen a significant increase in children coming into care. Between October and December, we brought in 25 children into care. In January alone, we brought in 17 children. We've kind of even out with our numbers because of children that find permanency and leave care. Some of the reasons children are coming into care, we had 6 dependency cases, which means we have families who are saying they cannot care for their children, and they are not able to find alternate plans. We had 7 children during that quarter that was both neglect and dependency, 9 just neglect cases, 1 abuse, and 1 abuse and neglect. Just a couple, we seem to be consistent with the profile of children in out-of-home care, and when we talk about neglect, the majority of abuse and neglect combination, the child issues are child behavior, and parent issues along with that tend to be the caretaker's inability to cope with those behaviors, and they look to our agency to help resolve those, whether that's bringing them into care, locating, giving them services, but that's the major for coming into care. some of the other presenting issues around is certainly substance abuse and domestic violence, and issues presented by parents or the inability to care for some of these children and their behaviors. So, any questions on that part? And I'd just like to share with you in terms of, lost my page. We touched on in December about the number of cases declared legally incompetent and guardianship was managed by this agency. I'm sorry, Eugene.
That's all right, you go ahead, Ma, I've got all day. I have a question.
I was afraid of that.
All right, down on page 18, really
Uh-huh.
caught my eye. You have at the top, young, at the bottom, the elderly. Is it that much in proportion to the number of seniors that we have that need help above the young? See, look down at the
Well, that was the
number.
next one. I was going to get to, are you talking about the APS?
like-
Oh, yes, that.
Right.
That's, I had seen that. But go ahead, but I still want you to kind of fill me in as to, and, see, the reason I'm so concerned about that, I'm on the advisory board for the senior citizens, and I know what they're going through with.
I actually
that's-
appreciate the numbers you're
Yeah,
giving.
and that's the reason I was questioning about that. Where's the greatest need?
Well, when we
See,
look at
and-
the APS referrals and what the issues surrounding those APS referrals, they usually involve caretaker neglect, where
Yeah.
there's somebody taking, that seems to be one of the highest categories. Self-neglect, when a person is not able to care for themselves and they don't have anybody else doing that.
Just saying this, Margaret. All right, one place that, you know, when the senior citizens, they're in the nursing home and so forth, they are allowed a certain amount of money. And then the nursing home and so forth keeps all the rest of it. But these, there are some workers that sometimes, they don't even get that amount of money because the other people intercept it and they get it. Who's to investigate that kind of stuff? And to me, what is the biggest priority as far as who needs the help? Oh, yeah, look, we've got so many needs. Don't get me wrong. I know that. I wasn't born yesterday. I know how we used to live, and still, so many still live that way. But I think on that, but go ahead. I'm sorry, maybe I shouldn't have said what.
I guess I'm wondering, you're thinking about why, one thing is why there's been a spike
Yeah. Yeah.
in
But we're more
number.
concerned, I think now, the public is more concerned because of television, newspapers, sheriff's department, and all of this, because it's brought before the public. And you know, we don't get the good things that people do, all the good things at social service, but you let them something go a little wrong, and what do? They jump on it like a,
Yeah,
Stay on TV.
can I
3
just, you
days.
want to say something? Let's do that first.
In relation to what you're saying, Mr. James, just back to this issue in the quarterly report, when we look at, there are currently 68 guardianship cases with the Department of Social Services. We can be guardian of the person, guardian of the state, et cetera. Again, people come in for lots of reasons, and they're declared incompetent, self-neglect, and they're assessed for that. What I think is interesting to note about the number is, when I was looking back at some of our statistics, just in 2010, we had 41 guardianship cases for incompetency, and at this time, we're up to 68. There's a lot of changes regarding mental health. The health department used to have some guardianship cases. It's also harder and harder to find families to take guardianship, and they look to our agency for that. These are very, very difficult cases many times, and it's not just elderly. When you talk about adult services, you're talking about anybody over the age of 18 years old. We have kids coming out of foster care that we're considering for guardianship at this point. So it's any person over the age of 18. I'd like at some point for some of our adult service folks around guardianship to come and give a presentation on that, because I think it's very interesting what's happening in our community. Some of the cases that mental health used to be so involved in has shifted to our department to deal with some of these folks. The training they would need to deal with some of these situations is far above what it is, the training that has been now.
And I realize that in the mental health, because of the changes that have taken place, it's put a bigger burden upon the social service department. And I understand that, I know that. But as I'm out there, I'm in a rural area. There are a lot of poor people out there. And one of my biggest problems is, I think, mental health. That's the reason we've got so many.
Yeah.
I think certainly mental
I think
health
it'd be good to have somebody
is
like that
a,
to come and talk to us sometimes.
yeah,
I really do.
sure, and I think that would be good, because I do a lot of work with the, with APS workers. Certainly, I have seen a spike in numbers of people at the hospital, that I've been seeing. Any other? did you
Just
need-
one last thing
Sure.
on the quarterly report, if I may, on page 19. I just wanted to remind everybody, and it's been a while since you've heard us talk about this, but about halfway down, the amount of taxable income brought into the county through the SOAR services. And if you don't remember what SOAR is the SSI and SSDI Outreach, Access, and Recovery, and with the acronym SOAR. And it's an initiative designed to help case managers assist adults who are homeless, especially adults who are homeless and have serious mental illness. We help them apply for Social Security disability. It's a more rapid, we have a partnership with the Social Security Commission. It's a more rapid process for getting homeless individuals with mental illnesses and disabilities through that process. This quarter, we had enough, you can see the next line down, $8,520 was realized by individuals who went through that process and were approved for Social Security disability, which means they now have their own income to live, whether that's going into a rest home or an apartment or supportive housing or whatever. So I just wanted to remind everybody that we were still involved with the SOAR program, helping them get finances. That's the end of my report.
Okay. Brian, did you? Okay.
If you would please look at page 24 of your packet. I'm highlighting the child support program and collections in that program. As of the end of the
Speak up a little bit, Brian, I'm sorry.
As of the end of the second quarter, December 31st, we had 8,703 cases under order. Almost 87% of cases that we are responsible for are under order. Our state target is 88.36%. And we're not there yet, but we're close to the target. Our collections, our annual target is $14,056,062, and to date, we've collected, as of December 31st, $6,602,352. Not quite halfway there at the halfway point, but typically, this is tax season, and generally, the third quarter, January, February, March, and sometimes even in the fourth quarter, April, we tend to see a boost in collections because of tax intercept. So if it holds true as it usually does each year, we should see a boost in collections during the third quarter based on the collections that are done through the tax intercept process, which is an additional means of collecting child support. That's my report.
Okay.
Mr. Manager, Mr. Chairman, before we get started on the director's report, I'd like for our manager to introduce our intern and administrator, our head
Okay.
doctor, and
All right.
we're so glad to have him. But I know he's in a position to take and to tell a little bit more about it, if he would.
Sure, Mr. Chairman, would you like me to?
Yeah,
do that?
sure.
We are pleased to introduce to you the subcommittee of the DSS Board dealing with identifying the interim director and making a recommendation on permanent director. For the interim director, Earl Merritt is is with the county now, began February 1st on an interim basis with Pitt County. Mr. Merritt just recently retired from Johnston County, has an extensive experience both in DSS as well as the NC Fast software implementation within DSS. And I'll have to say that Mr. Merritt has hit the ground running at full speed, and we need him to continue running at full speed. But I don't know if Mr. Chairman, if you have anything you'd like to say?
I agree with that. That was what I really liked about him, was that he would be able to hit the ground running, and not just running. After meeting with him, he's hit the ground running and thinking at the same time,
Exactly.
which sometimes is very hard to do. So I really do, because sometimes people are running and they're not thinking. He's running and thinking, which is very good. I really appreciate that. What I need to do is, there are two amendments to the agenda that I neglected. One is we're going to discuss the director search and also go into closed session regarding a personnel issue. I'd like to get a motion on that, on those.
What would you like pertaining to the, looking for a director in that particular part?
Right,
Would
yeah.
that have to be in closed session?
No, I could
Yes,
just
sir.
go over just some of the general things where we
Yeah.
are right now. And the other part is a personnel issue that we'd like to go over. I'd like to get a motion on those two.
I make a motion that we add those two specifics to closed session.
Only the one is.
Only
open
the
session.
one,
That's
only
what I
the,
wanted to know, which one.
Only the
the,
personnel issue?
right.
Correct.
Yeah,
Okay,
the
I make a
director,
motion that we add the personnel issue to closed session, as well as another item to the open session.
okay. Motion has been made and
A
seconded.
second, there you go. Need a second.
Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed have the same. Okay. All right, we're gonna turn it over to you and show them that you can run and think at the same time.
I hope I can demonstrate that. First, let me say, as far as the NC Fast backlog, we met all our federal mandates. Staff worked Saturday and Sunday again this weekend. And let me compliment Brian Averett and the staff over there. They've been working 12-hour days. They've been working on the weekends. And we've had some real good assistance from the state. They sent some very good people down here, and we have met those initial goals. So Pitt County, and thanks to them and to the staff, they have really, really worked hard. But our work is not done yet, and there'll be another deadline. The hard launch for Medicaid will come sometime. We don't know when it'll be. So we need to develop readiness plans, both for food and nutrition and for the Medicaid program. I feel confident that we will. The state has left their staff here at my request, and I think they took everybody's home this morning. Everybody else is home. And they're going to assist us in developing our readiness plans. But once again, do not let me fail to compliment this staff. You've got some great people here. They've worked really, really, really hard to get this done. It's not been an easy task. As I said, they've worked 12-hour days, and they've worked on Saturdays, and they've worked on Sundays, and they've done an outstanding job. We had, what you did, over 1,200 cases in the last 2 weeks. Cleared out over 1,200 cases. I'm hopeful by tomorrow at this time, all the cases will be completely cleared out.
Hold up, did you say what now? In the last 2 weeks, you've done what?
This staff has cleared out over 1,200 cases.
Very good.
Sounds like magic.
Well, it was hard work. It's hard work, but, so, and I'm most appreciative of them. I think there's some things that we can try to look at that can possibly make us more efficient. One issue I see is, and we'll look at the telephone report in a minute, or we can now, but I think there's, where is that?
On the
There
cover
were
sheets.
over 2 million telephone calls here last year.
We tend to get a lot of them.
Well, that doesn't count yours. I think we've talked to the technology staff, and we're looking at now a possibility of setting up a hunt group where we can get more people answering the telephone, to set up another group over with the public assistance programs to take those calls, to take those requests, and to be able to get back with people.
Could you explain that a little further? We've talked about it. Just tell them how that process would work.
A hunt group is if they call the receptionist, there's 3 identified now, I think, is that correct?
Yes.
If they call them and all 3 of those lines are busy now, they get, it rings and rings and rings. You identify additional people for it to roll over to take those calls and handle them. And so you don't get such a backlog when people call, and I'm sure that makes a very bad impression if people are trying to call and it rings 50 times or something like that, which I'm not saying it does, but it's possible. So
I could just jump in for a minute. One of the things that we share. The thing that is very important is that maybe we have maybe 15, 20 people that would be identified, and so would roll over into different people, so that therefore instead of just having 3 opportunities for somebody to get a direct call and perhaps interaction, we now can have 20. Okay, and what has happened is by doing that, we've gotten more people involved without spending a dime, and that's great. That's really a very good idea, because I've always been concerned about the fact that we had 3 people kind of answering the phone, and now we're going to have a lot more, and that's a great idea.
We're also looking at setting up a group over in the public assistance unit to take the calls, take people's questions, take their identifying information, and come up with a process for somebody to answer them on a timely basis. And number one, get our work done, but cut down on the frustration of the people that we try to serve, since that's why we're here. There are other, I think kiosks were already planned before I got here, but there's a process where you can put computers out in the lobby and you can put somebody out there to help them. And in the NC Fast system, they can do part of their application in the lobby. And you may put 1 person out there to help 6, and I think it's maybe eventually planned up to 12, is that not correct? To help those people start those applications so that they're not sitting there getting frustrated while they're there. And they get out there, they start that application. When the income maintenance caseworker gets it, a lot of the information and the work that they would have had to have done is already there and already available for them. Also looking at possibility of having 1 person scan the mail and attach that to the case in NC Fast, which will eliminate the need for so many hands to touch paper. And we could set up an index and people can go back and look at that information too. So those are just some of the things we're talking about. And believe me, they're not all my ideas. A lot of it I've been over with the staff over there about every day I've been here. And they've got a lot of great ideas over there too. So let me compliment them again, because they've done a super job, and I know they'll continue to do that, and hopefully we can get some processes that they can't work any harder, so we got to work smarter. And I think the opportunities are there, and we're going to try to do that.
Really appreciate a lot of the ideas, and again, the way that you're looking at the agency. A lot of that is because you've had a good bit of experience, and your ideas are very good. I really appreciate those.
Let me say this on behalf of the citizens of Pitt County, Margaret, to the workers. I know you all have been, most of you before you got it here, but we appreciate so much, because now they don't have to worry about these long lines, I hope, for a while anyway. And that's very important, because you go out there and you have to wait 2 or 3 hours, and then you don't get to see anybody.
Come back tomorrow.
Yeah,
Come
you
back
come back
Back
tomorrow.
tomorrow now.
And maybe we kind of have eliminated those problems, and we're hoping we won't have them again. We really do.
And may I say, Ms. Burns has been handling the layout process, and she's come up with creative solutions to do that, and I know she's got a report for you too on that I don't think is listed here on the agenda.
Do we need a motion for that, to add that to the agenda or not? No, okay.
Okay. The LEAP program, as you all know, began December 1, and we had that period for the target population that ran till January 31st for the elderly. On February 1, the program opened up for anyone. At this point, anyone can apply. And the LEAP program provides a one-time vendor payment to assist with your heating bills. The eligibility is based on your income and the household composition. The program is located at 1710 West 6th Street this year. But we also, on the first couple of days that the program started, we were very busy. We had large crowds of people applying for the program. And so at that point, we set up 3 workers in this building that are also taking applications. And what we are doing is that everyone has to go to the 6th Street location in order to register. Once they are registered, then we're sending 14 to 20 people over in groups. And we're doing at least 3 groups a day. And they are coming to this building, and the 3 social workers in this building and 2 interns who are assisting us are doing the applications over here. So that's how we're moving the crowds through the 6th Street building and this building.
So no apps are being taken over there?
Yes, there are 5 workers taking applications in the 6th Street building and 3 workers taking applications in this building.
It's the overflow that comes over here?
It's the overflow that comes over here.
Okay.
But you don't have that much money. A lot of them not gonna get anything, are they?
We have plenty of money this
Oh, you
year.
do?
Yes, sir.
You had an increase.
This year,
Well, that's pretty good.
this
then.
year we started out with $1,138,654. At this point, as of Friday morning, we have $894,254 left. This year, what the state did was, a lot of the crisis intervention money has now been moved to the LEAP program, and that is what the directors wanted to happen. So we have more money in the heating program this year. The program is going to run through March 31st, and or until funds are exhausted. From the spending of the funds so far, we will probably have funds until March 31st. But we are working as hard as we can to get as many people served as
Will you
possible.
tell who is eligible for that while you're talking?
Okay, anyone can apply at this point, Mr. James. Anyone who wants help with their heating can apply for the program. It's open to anyone, but it is based on your income and your household composition.
Well, that's what I was talking about. What is that? I know anybody can apply, but there's no need of them applying if they go over this list, over that income and so
How
forth.
many
It's-
people we talking about?
How many people have applied so far? At this point, we have approved 1,065 households as of Friday morning.
Sounds good.
And 128 households have been denied based
Just
on
got
their
started, and you
eligibility.
just got started.
We got started in December.
And you
December
notify
1.
those that are being denied immediately so that they will.
Yes, sir. Whether you're approved or you're denied, you are notified in writing.
That's good.
And what has happened, earlier at the meetings, we had talked about how they were getting the word out, and that was through television, various papers and things of that nature, as well as I think some of the people that might be eligible got that information directly.
That,
what I recall.
that no longer happens.
Oh, okay.
It used to be that if you were eligible for food stamps, that you were automatically eligible
Mm-hmm.
for the heating program. That changed 2 years ago.
Okay.
And now everyone has to apply.
Okay.
Let me say, through Ms. Burns' innovation, we had a crowd problem the first day that was open to the general public.
so.
But when she set up these groups and handled them so seamlessly, I think the crowds have not been an issue since the first day, have they?
They have not been an issue since Wednesday of last week.
Right.
Monday and Tuesday, we had issues with the crowd. But since Wednesday, the crowd has been able to flow to the point that we can meet people's needs.
Okay. Any other questions?
I guess they're gonna give you a stick of gum.
I'd just like to state where we are. As you know, there's a subcommittee to find a new director. At this time, we have approximately 12 resumes. Is that correct?
Yes, Mr. Chairman, approximately 12 applications, maybe 13. It's
Yeah, and
preliminary.
that what we're doing is we're going to be
16.
16,
16, I'm sorry.
and that we'll be reviewing them and going through them, and we'll be reporting back to the board with our findings.
And, Mr. Chairman, as board will recall, just to remind you of the process, the subcommittee is going to vet and look at those applications using Sylvia Johnson to assist us to figure those applicants who are fully qualified to be considered. Once those that's determined, then the subcommittee will then deliver to you 2 or 3 top applicants for your process to interview and to consider their qualifications.
And we should, go ahead.
Yeah, we are certainly blessed that we got Mike here with us. We really are. So we got time to take a look and make sure we find a good director to come in to lead the social service department here in Pitt County.
Mr. Barrett, you mean?
Yes, Mr. Merritt. And we're hoping he's gonna stay here until we get that good person.
He won't give him a
Well, I
stick
hope
of
you
gum.
won't,
No, I
I
hope
hope
we-
you want me that long.
We were blessed
Okay.
to have you, let's say that.
Okay.
I didn't do these yet either.
Oh, okay.
You have your vacancy report. I think they're pretty self-explanatory.
This is on page 25. We're talking about.
Didn't we get some corrected sheets?
Maybe an updated one.
Yes, you should have one
Yeah.
in front of you.
Yeah. This one here. It was 25 in the original packet, but the.
But we gotta correct.
Right.
With no name, no date,
No
no
number,
number.
right. Mhm. Okay.
Also, you have your telephone reports that you had 207,599 calls in the month of January. And we included the data I was talking about earlier about the progress we've made over the last couple of weeks in the food nutrition program.
Yeah. Just looking at that is a very good, lot of improvement, and we really appreciate that. Okay. What I'd like, do I need to get the motion and then have you read that? Okay. I'd like to get a motion to,
I move we go into executive session, Mr. Chairman.
I'll second it.
okay. Motion has been made and seconded. All those in favor? All those opposed? Okay.
North Carolina General Statute 143-318.11 regarding closed sessions, also including subsection 6, Section A, permitted purposes. It is the policy of the state that closed sessions shall be held only when required to permit a public body to act in the public interest as permitted in this section. A public body may hold a closed session and exclude the public only when a closed session is required. Also, item number 1, to prevent the disclosure of information that is privileged or confidential pursuant to the law of this state or the United States are not considered a public record within the meaning of Chapter 132 of the General Statutes. To consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment of an individual public officer or employee or prospective public officer or employee, or to hear or investigate a complaint, charge, or grievance by or against an individual, public officer, or employee.
Seemed like that got longer.
All right. Thank you.
You covered everything, sir.
Okay.